If you've been giving your dog glucosamine for months or even years and you're not seeing the results you expected, I need you to stay with me for the next 10 minutes. Because the problem is not that joint supplements don't work. The problem is that we are completely skipping the foundation that makes them work. Welcome to Woof Nutrition. I'm Penny, a holistic pet health coach with over 20 years of experience in integrative pet nutrition. May is National Pet Month, and this entire month we are going deep on one topic: joints and mobility for dogs and for cats. This is the first video in the series, and I want to start here with the question I hear most often from clients. I've been giving my dog all the supplements. Why isn't anything changing? So, here's the glucosamine problem. Let's talk about glucosamine for a minute. It is the default go-to for joint support, and it has been for decades. And glucosamine and chondroitin are real compounds with real biological functions. Glucosamine is a building block for cartilage. Chondroitin helps retain water in the cartilage matrix. These things matter. But here's the problem with supplementing them orally. Studies on oral glucosamine, both in humans and in companion animals, show inconsistent results at best. And a large part of that is bioavailability. Oral glucosamine is broken down in the digestive tract before it can reach joint tissue. The amount that actually makes it to the joint is relatively small. Now, add a second problem. Most dogs who need joint support have some degree of gut inflammation or compromised gut lining. So their ability to absorb anything, supplements, nutrients from food, everything, is already reduced. You're applying a supplement to a system that cannot properly receive it. This is the first piece that most joint protocols completely skip. Let's talk about what I call the gut-joint axis, because this is the foundation everything else rests on. Systemic inflammation, the kind that destroys cartilage and drives the pain and stiffness we associate with arthritis. This starts in the gut in the majority of cases. When the gut lining is compromised, what we call intestinal hyperpermeability or leaky gut, undigested particles and bacterial byproducts pass into the bloodstream through gaps in the gut wall. The immune system responds to these as invaders. The result is a chronic, low-grade inflammatory fire that circulates throughout the whole body. The joints are a primary target tissue for this kind of systemic inflammation. They are highly vascularized, they are under constant physical stress, and they have their own immune-active tissues. So inflammation shows up there, and it shows up hard. This is why you can have two dogs with the exact same diagnosis, both with hip dysplasia, or elbow arthritis, or degenerative joint disease. And one does beautifully on a protocol, and the other makes no progress at all. It comes down to the gut. The dog whose gut is functioning well can absorb joint supportive nutrients and moderate its own inflammatory response. The dog with chronic gut dysfunction is fighting an uphill battle, no matter what you put in the bowl. So what does this mean for your approach? It means the gut has to come first. When I work with a client on joint issues, I use what I think of as a 4-layer protocol. This is the framework we're doing to unpack all month in this series and inside the members circle. Layer 1 is gut restoration. Before we add a single joint supplement, we look at the gut. Is there evidence of dysbiosis, bacterial imbalance? Is there a history of chronic loose stool, intermittent vomiting, gas? Has this dog been on repeated antibiotics or steroids? All of these point to a gut that needs support before anything else. Gut restoration typically involves targeted probiotics and prebiotics, gut lining repair nutrients like L-glutamine and colostrum, and dietary changes that reduce inflammatory fuel. Layer 2 is anti-inflammatory nutrition. Diet is medicine. The standard commercial diet for most dogs is high in refined carbohydrates, high in omega-6 fats from seed oils, and low in moisture, diversity, and phytonutrients that modulate inflammation. Shifting the diet, even incrementally, can create a measurable change in inflammatory load within weeks. Layer 3 is targeted joint support. Now we add supplements, and here we can be much more sophisticated than a basic glucosamine chondroitin product. I will tell you which compounds I actually use in a moment. Layer 4 is movement and lifestyle. Low-impact, consistent movement is one of the most powerful tools for joint health. It maintains muscle mass that supports and protects joints, keeps synovial fluid circulating, and maintains range of motion. Weight management sits here too. Every extra pound adds 4 to 5 pounds of pressure on joints during normal movement. So which joint supplements do I actually use in practice? Here's my short list. Green-lipped Mussel, one of the most well-researched joint supplements we have for dogs. It contains a unique omega-3 fatty acid profile, specifically ETA, eicosapentaenoic acid, that you do not find in regular fish oil, plus glycosaminoglycans native to cartilage. The research on green-lipped Mussel for canine osteoarthritis is genuinely solid. Type 2 collagen, native, undenatured. Different from hydrolyzed collagen most people are familiar with. Native type 2 collagen works through oral tolerance. It trains the immune system not to attack joint cartilage. That dose is very small, about 10 milligrams, and the mechanism is completely different from a building block supplement. Boswellia serrata, frankincense resin. Excellent clinical evidence for reducing inflammatory joint pain. It inhibits specific inflammatory enzymes without the side effects of NSAIDs. I use this regularly. MYOS. This is a fertilized egg yolk concentrate that inhibits myostatin, the protein that breaks down muscle. Maintaining muscle mass around an arthritic joint is critical. Without strong supporting muscles, the joint absorbs more impact. MYOS is one of the few things I have seen genuinely preserve and rebuild lean muscle mass in older dogs and cats. And medicinal mushrooms. Reishi for broad anti-inflammatory and immune modulating properties. Turkey tail or chaga. This is for microbiome and immune support that underpins the whole protocol. If this framework is resonating with you, if it's starting to explain why you haven't been seeing results, I want to invite you into the member circle this month. We're going through this entire protocol in depth in our May Masterclass, Joints and Mobility. Canine track, feline track, species case studies, and a build your own protocol framework so you can apply this to your actual animal. The link is in the description and in my bio. If you're not ready for that yet, subscribe so you don't miss the rest of this series. Next Tuesday, I'm sharing a real case, an American bully with acute digestive distress and the joint improvement that happened when we fixed his gut first when we adopted him. You do not want to miss it. Thank you so much for being here. I'll see you next Tuesday. Small amounts to begin seeding beneficial bacteria without overwhelming a dysbiotic gut. Omega-3 supplementation, fish oil or algae oil for anti-inflammatory support throughout the system. Now, week 3 is re-inoculate. This is a really important step. It's about repopulating the gut with beneficial bacteria.